Welcome to another episode of Positive Solutions for Life. Today's guest is Dr. Diana Driscoll, an authority on the autonomic nervous system. Dr. Driscoll is an optometrist and world-renowned expert on POTS and other invisible illnesses. Her personal battle with POTS inspired a decade of self-funded, groundbreaking research and innovative treatment to get the answers for patients today. As an author, speaker, inventor, and devoted researcher with five patents to date, Dr. Driscoll has dedicated her life to helping those affected, earning her the title of the patient's researcher. So, welcome to the podcast, Dr. Diana Driscoll.
Thank you for having me. It really is an honor to be here, Peggy. Thank you.
Good, good. I am so excited for our conversation. One, because I'm just be honest, I have no idea what I have no idea what POTS is, like the invisible diseases. Like, I don't know about, but more of the journey, I think, because, this is transforming from the inside out. And you probably really had to do a lot of digging deep. And obviously, as a researcher, transforming different things and just pulling from all different things to make it happen. So before we get just too far into it, can you share just a little bit more about you, your journey, and how does led to where you are today?
Yeah, it's kind of, I'll try to be brief. I don't know that anything in the journey was brief, but I'm
Right, right.
an optometrist by education, as you
Okay.
mentioned, Peggy,
Yeah.
and was happy practicing optometry until I got a virus when I went on a mission trip overseas, and all of us got sick. We all got the same virus, but I didn't seem to recover.
Mm.
And weird symptoms started creeping in, and I became basically disabled in 2 weeks. Nothing in my body was working properly. And eventually got the diagnosis of postural orthostatic tachycardia syndrome, which is diagnosed when a patient gets vertical, their heart races,
Mm.
and went to probably 50 doctors, traveled the nation looking for answers. I was in clinical trials for it. And ultimately, the doctors told me they just didn't understand it.
Mhm.
One of the researchers, after like 3 years of illness, said, well, we think patients with POTS are
Mhm.
actually perfectly healthy. They're just more aware of their own bodies. You have got to be kidding me. I was disabled. And then eventually, years later, my kids got sick. My son missed 3 years of school. This wasn't something we could just push through. It wasn't like we were just tired,
Yeah,
we
yeah.
couldn't make our bodies work.
Right,
So,
right.
when we were told they didn't have any answers, I thought, could I be in position to
Yeah.
get some answers? I have a
Mhm.
medical background. I set
Mhm.
up a corporation to house research and just started. I didn't know it would take 10 years, to get all these layers figured out. But ultimately, there was a good ending. Like you mentioned, 5 patents to date. It was all new for
Yeah.
people. So, quite the journey of struggle and being told initially there were no answers
Mhm.
and well, let's just see. Yeah.
Yeah.
That
Yeah.
positive attitude you mentioned.
Yeah. Well,
Hmm.
just that has got to be one just stressful event. I mean, you said disabled in within 2 weeks. I mean,
Yes.
you have a lively practice. I mean, you're very
Right.
lively and just like active. And it's like all of a sudden, boom, the world
Yes.
shifts and no longer can be able to work.
I never saw that coming.
No.
I was not someone who would have understood like an invisible illness.
Yeah.
I
Yeah.
remember hearing the term chronic fatigue syndrome and
Yeah.
thinking, well, I don't get it. We all get tired, but
Right, right.
until I got sick. And literally nothing in my body worked properly. It wasn't just heart rate. I
Mhm.
couldn't breathe properly. I couldn't sleep. My digestion shut down. I couldn't control my movements. I was shaking. It felt like being flooded with adrenaline. It was like your body's going through a panic attack without you, if that makes any sense. I was in control of nothing. And then as it evolved, it morphed from extreme insomnia to I couldn't stay awake. I was
Mhm.
hallucinating sometimes. It's just a horrible condition to be
Yeah.
in.
Yeah.
And then when my kids were sick too, watching
Right.
them suffer,
Right.
brutal. I just don't think anybody should go through that. But, I
Yeah.
never saw that coming. I'd always been, as far as I knew, healthy and active,
Right.
um, but a mere virus could do that. What the heck?
I know.
Now we're seeing probably 40% of our patients at pod scare are post-COVID. That is a
Mm.
SARS virus that's significant enough that it can trigger that in
Oh, wow.
patients who are predisposed. We're seeing more of it. Yeah.
Yeah, that's what I was like, oh gosh, I wonder how like the more recent stuff has been able to like it just catches on, I suppose. But that that but your research and stuff for all of those years probably played a great role in being able to give at least some hope to some people that
Mhm.
and some understanding. I mean, that had to been very, very difficult to be able to go through doctor to doctor to doctor to doctor and not have like any answer. So what was the turning point that you decided, okay, I might have to take this into my own hands?
Yeah, the turning point was the day that the head researcher at our research hospital said, "We think POTS patients are perfectly normal. They're just more aware of their own bodies." That was the minute it hit me that I knew I was on my own. And
Yeah.
I thought, okay, I don't even know where to begin with this. It
Mhm,
affects every system of the
mhm,
body. I
mhm,
thought, well, let's start by looking in the eyes.
mhm.
That's my
Yeah,
comfort zone,
right,
right?
right.
And the eyes are oftentimes indicative of systemic illness. It's the only place in the body you can look directly at blood vessels. You can look at
Mm,
the optic nerve, a cranial nerve
mhm.
directly. I thought, well, let's just start there.
Yeah.
So the first study we did involved 30 patients and 30 age matched normals. And I
Mhm.
just looked in their eyes. I was the blinded doctor. I wasn't told who was a patient and who wasn't,
Right, right.
and had to guess which one was a patient. And I was correct almost 90% of the time.
Oh, wow.
So we knew those indications were subtle, but they were clues.
Mhm.
And the research more from there. So
Yeah.
a very difficult puzzle, but I just had to pick some place to start,
Yeah.
right? And that was a
Yes,
good place to
yeah.
start. It wasn't a place to end. Wasn't
No,
all the
no.
answer, but it was a good place to start. Yeah.
Yeah. Well, your natural, tendencies, you have that education, you've had all of that knowledge. And how did that progress? Like how like, research like one thing after the other and how did like it's in a is it true it's like autonomic nervous system, right?
Yes.
It's kind of has to do with that. So how did you like put the pieces together?
Yeah, isn't that crazy? The
Yeah.
autonomic nervous system, I will say, is the part of the nervous system. One, you don't have to think about it. It works all by itself,
Right,
So
right.
it like controls your heart rate or your
Mhm.
digestion, makes your gallbladder work, tear production, things that you don't have conscious control of, nor do you need to, right? It works
Mhm,
by
mhm.
itself. But when that goes wrong, all kinds of horrible things happen.
Yeah, yeah.
But doctors don't like the autonomic nervous system. We don't really understand it fully.
Right, right.
It's like this invisible part of the body that's supposed to work on all by itself. So I had to go deeper than literally anyone ever had before.
Mhm.
I will say, was it an advantage, if you want to call it an advantage?
Yeah.
I was sick, right?
Right,
So
right.
I could use my body. I did a lot of work with my body.
Mhm,
I had my
mhm.
kids at home. It could also be my little lab rats. And
Right.
then I had outreach to other patients online,
Mhm,
thousands across the world.
mhm.
So I utilized that and was able to move through the research so much faster than, say, a large academic institution.
Mhm,
I didn't
mhm,
have to pause for years to get funding,
mhm.
to get a grant or whatever, do the whole deal. We
Right.
could move much faster.
Mhm.
Patients could not wait for all these studies or a new drug or whatever
Right, right.
to go through. I certainly couldn't wait. My kids
Yeah,
couldn't wait. Our
yeah.
lives stopped. So it was the mission was to get answers, figure out what medicines or supplement blends or what have you exist currently that if we
Mhm,
know the mechanism of action that we can use those to
mhm.
help correct some of these problems. And then the patients are all different. So it wasn't
Yeah.
like everything was all about me, or even my kids. But instead, when all that was figured out, the question came, what else would get patients to the same place? And what
Mhm,
else would make that worse? What could
mhm.
happen so we can help other people? Right?
Right, right.
Extraordinarily complex. Yeah.
Yeah. Yeah. I mean, this is like a huge puzzle. And
Yes.
and I want to say that the puzzle pieces are, all can be kind of similar, but yet very, very different because everybody is a little bit different. And I would assume that it could be, manifesting a little bit different in every person. I'm sure
Right.
I'm sure your kids and you probably didn't have the same cookie cutter things. And so that makes it even more complicated. And
You
so,
are exactly right. My kids and I turned out to be different. And even when we got down to the genetics of it, it
mhm,
was different. There were some commonalities. And even
mhm,
with the patients we see at POTS Care, we start with the commonalities and then
mhm,
we look for the differences, right?
mhm, mhm.
So if patients' heart rates are racing when they're vertical, something is causing that.
Right, right.
And then the dominoes that fall, because it does affect the cardiovascular system, are similar. We can start with those dominoes.
Hmm.
Initially, I put out a book, The Driscoll Theory. It's been, gosh, 12, 13 years now, that exposed some of those commonalities,
Hmm.
like a propensity to develop high intracranial pressure. The vagus nerve was part of the system that was
Hmm.
affected by the
Hmm.
inflammation, the cardiovascular effects, et cetera. And we can start to put corrections in place for that. We
Hmm.
should start to get better. Right. So, yeah,
Yeah.
complex. You're right.
Very
love,
complex.
I love a medical puzzle. Honestly, I think if anyone had to go through this journey, I was
Right.
a great choice because I love a medical puzzle.
Yeah.
So yeah,
Well, I mean, and that's a gift that you have that you could bring to everybody. And is that how you got the term, the patient's researcher? I mean, you just keep digging, right? Keep digging.
yes, that one I was motivated because I
Right.
was a patient,
Right.
right? But two, we couldn't wait again for that
Yeah.
long, typical research
Right.
journey of a couple decades to get the treatment paradigm
Mhm.
laid out. We couldn't
Right.
wait for that. We
Right.
had to move fast. And I
Right.
walk away from that looking back, thinking, Peggy, there are so many ways to speed up research. Like
Hmm.
I could move very fast because I didn't
Hmm.
have the
Yeah.
cumbersomeness of a
Yeah.
big institution. It wasn't by committee, I
Yeah.
could figure things out quickly and move quickly.
Yeah.
So I look back at that and I think, what other conditions, what other medicines, et cetera, could be sped up for patients? They can't
Yeah.
wait for that.
Yeah. Yeah.
Yeah.
Yeah, because
Mhm.
it's trying. I mean, I'm sure like most of the I couldn't even imagine. I mean, it was like being tired, being your world flipped upside down, but yet
Yeah.
you had the background to and I guess the gift to be able like let's dig a little deeper, let's figure this out. It can't, start with the commonalities.
Right.
And then, so when people have like, okay, what are some of the invisible illnesses that kind of wrap around this? I mean, because is it
Yeah.
just one thing? I mean, it's not one thing, because obviously we've talked about you having different, symptoms, kids having different symptoms, and
Yes.
other people coming to you. What
Yes.
it all entails, like the invisible illnesses.
Well, what ultimately I was able to figure out was that a lot of these invisible illnesses, they're not truly invisible, right? We're just not measuring the right things. And the vast majority of patients are inflammatory patients with
Mm,
the types of inflammation that can lead to things like POTS or even these other invisible illnesses like chronic fatigue syndrome, fibromyalgia, et cetera, that they're missed because traditional markers of inflammation don't pick them up.
mm,
So we have to go to much more specific chemicals, and that was really the only way to get answers.
mhm,
But once those uh, true origins are discovered, the
mhm,
labels that we're using for these invisible illnesses is just horrible. They're
mhm,
too subjective. They don't validate the patients at all. It
mhm.
sounds a little hokey. It sounds a little bit like, well, they're just depressed,
Yeah.
Yeah, and it's not. So my goal is to eventually get to the very specific objective diagnosis
Mhm,
based on the genetic
mhm,
tendency for whatever type of inflammation the
mhm,
patient's dealing with the specific markers identifiable in the blood. And
mhm,
the label isn't POTS or chronic fatigue syndrome or whatever. It's
mhm,
whatever that inflammatory tendency is. And only when we do that are
mhm.
patients really going to get the help they need. So doctors are not going to understand these vague subjective labels, nor
Yeah.
should they? I wouldn't have understood.
No, I would. Yeah.
Yeah. So part of our mission is to release the genetics, explain everything,
Mhm.
change all the labels.
Yeah.
Exhausting. And then all that needs to get into medical schools, into the textbooks, and taught and move forward.
Right.
So,
Right.
meanwhile, can we help patients today? Absolutely. We do it every day. We
Yeah.
have to, right?
Yes.
But
Yes.
it's very frustrating for the patients to go through that,
Mhm.
even when they recover and they still can't get the validation for, oh, what was it you were dealing with? Well,
Yeah.
a condition that doesn't really have a label,
Yeah.
it's a
Has
terrible.
something to do with this system, inflammatory stuff.
Yeah, and that gets them no validation at
Right.
all. So
Right.
someday that will change.
Yeah.
Very
Yeah.
frustrating. Hmm.
But for patients that come and get some information from you guys, I
Hmm.
mean, how transformative that can be for them to be validated. Like, hey, this
Oh, yeah.
isn't just something that we have, we're just going to kind of throw some things at the wall, see if they stick, like you have
Right.
some process of like trying to dig really deep and get down to what it is, that is, that can help them the best out of it.
We want complete recovery. We
Yes.
don't want to throw anything at them, go, well, maybe this will help. We're not really sure what's wrong, but maybe that'll help. And I
Yeah.
see that happen all the time. So instead, we're going to drill down and figure out what specifically happened,
Mhm,
what
mhm,
dominoes have fallen from that, lay out a plan,
mhm,
achieve recovery. And then generally, the patients need something to stay on top of their health. So,
mhm,
like, I got triggered by a virus. My son got a series of 3 viruses.
mhm.
If SARS or whatever comes along and gets
Yeah.
that going again, what can we do so we don't get sick again as
Yeah.
humans, right?
Yeah.
And that's important for them moving forward. It isn't all just about POTS recovery.
Right.
It's about maintaining the health. And
Mhm.
now, Peggy, especially as I'm approaching, my senior years, it's what I've learned to me is how can I stay not just healthy, but how
Mhm.
can I be healthier than even my peers? Is
Yeah.
what I've learned about the autonomic nervous system, chronic inflammation, even cardiovascular health. Can I utilize that now? So
Mhm.
even as I go into my very old age, I
Right.
don't necessarily have to deal with those typical old age illnesses.
Yeah. Yeah.
And so far, so good. I will say I'm probably the most active person I know of any age. I'd like to maintain that.
Yeah.
And it's also about being the healthiest we can be at any time
Mhm.
in our lives. It
Mhm.
isn't as much about POTS or
Mhm.
invisible illness, but what did that dramatic condition teach me about
Yeah.
being the healthiest person I can be today?
Yeah. Yeah. Can you share just a little bit, like, okay, what is that? Like, hey, what's those secrets? Like, I mean, it's kind of like, so it's like,
Not really secret.
I want to be old in my senior years and beyond and be active and stuff. But
Yeah,
I don't know. I'm kind of like, I've been blessed with not having a lot of illnesses in my life. But what I've, learned from a lot is that there are some basic things we can do to keep us healthy and keep us moving.
yeah,
And I'm just
yeah,
curious, what is your take on, okay, what have you learned and how do you help yourself, maintain this good health, even if there's like other viruses that could come attack you and like
yeah.
shut you down again?
Yeah, and I don't worry about that anymore. I
That's
know
good.
in the first couple of years of recovery,
Oh,
I
yeah.
felt very fragile. I
Hmm.
felt like if one thing goes wrong, the whole apple cart's going and stuff.
Yeah.
Most of our patients kind of go through that. It takes a while to become,
Hmm.
solid in that feeling
Right.
of recovery.
Right.
I feel like I could be hit by a truck. I'm going to be
Yeah.
fine because I know my
Right.
body, et cetera. But yes, there's so many things I walked away with. I will mention those 5 patents you talked about.
Hmm.
One thing that was hugely groundbreaking, and I still maintain this for my health today, is I'll always be an inflammatory patient. I'm not sick, which is
Hmm.
important. But the inflammation does interfere with the autonomic nervous system. And part of what I worked on is a supplement blend to keep the parasympathetic nerves working. I wanted to prove that this was actually stimulating the receptors of these nerves.
Hmm.
We could prove it by
Hmm.
bowel movements, digestion, gallbladder, and interestingly, pupil size and tear production. So the supplement blend that's out there is called Parasym Plus. I continue to stay on that
Hmm.
because even when my inflammation is up, I don't want it to interfere with anything.
Right.
It
Right.
doesn't.
Yeah.
And then the vast majority of inflammatory patients, and we're all inflammatory
Mhm.
as we
Yeah.
get older.
Yeah.
It's what we call inflammaging, right? That's
Mhm.
going to happen. And there's some things that can make us more inflammatory, autoimmune conditions, stress, uh, powerful athletes, they go through something similar,
Mhm.
in addition to aging. Even menopause, for example, can be inflammatory. But inflammation also causes oxidation, and
Mhm.
the oxidation worsens the inflammation and it changes our brain chemistry. And we
Mhm.
can see this in patients fairly dramatically. And having lived through this, I don't ever want
Mhm.
to go through this again.
Oh, yeah.
It increases kind of this anxiety type presentation. It can feel or present like anxiety, or it can present as almost an OCD, attention to detail. We want things a certain way.
Mhm.
It can get to the point where it's nearly impossible to live with us because we have such a high bar and we
Yeah.
expect everybody to have the same bar, and that's not really the way the world works, you know. Or patients can even get to the point where they can't even leave their home, or like I
Mhm.
couldn't make a phone call, I couldn't order a pizza, you know, I just
Mm.
couldn't do
Yeah.
it.
Yeah.
But staying on top of the oxidation is hugely helpful, and I maintain that too.
Mhm.
One of the supplements called NAC Max does that. I just carried it around with me when I was sick.
Mhm. Mhm.
But exercise has always been important to me.
Mhm.
I mean, I taught exercise and stuff when I got sick. I was in great shape.
Yeah.
It's still very important to me. There was a time in my illness, I got to the point I was bedridden. I couldn't do
Mhm.
anything. But as I got healthier and stronger, that's a key part of my life.
Mhm.
Nutrition also was like a hobby of mine. So when I got sick, I was eating great. I was exercising.
Mhm.
As far as anyone would know, I was very healthy. So it wasn't like I got sick because I wasn't taking care of
Right.
myself.
Right.
And when the doctor said, well, eat right, exercise, I go, well, lack of that didn't make me sick. So
Yeah.
how's that going to make me well? That just didn't make
Right.
sense at all.
Right.
Having said that, staying on top of that absolutely helps.
Mhm.
So yeah, I'm a
Mhm.
huge
Yeah.
believer in that.
Yeah.
And is really kind of the point of your podcast, I think, never losing hope.
Mhm.
Hope is such a powerful thing.
Mhm.
And initially, I'm so glad in my journey, I didn't know it was going to take at least a decade to
Yeah.
pull out of this, right? That would have been horrible. But I
Right.
tried to always maintain hope, if
Mhm.
not for me, at least for my kids,
Yeah. Yeah.
right? To tell them we're
Yeah.
going to stay at it.
Mhm.
That that is something I also walked away from going,
Mhm.
whatever we face in life, let's never give up. Let's always
Yeah.
maintain hope. Yeah.
Yeah. I think that is huge. I mean, I'm looking at, research and just the books that I'm reading and stuff too, is just that element of hope.
Yes.
When you can hang on to a sliver of light, that I mean, that changes our chemistry. It changes how we view things, and it is really important, especially when we're struggling with something really difficult, just to hang
Yes, no,
on.
absolutely. There were so many dark days in this illness, dark
Yeah.
years, you know. But one
Yeah.
thing I always tried to pull out was there's always something else I can try or learn about.
Mhm.
There's
Mhm.
always something else. There was
Mhm.
never a closed door
Mhm.
entirely,
Yeah.
right? I think I remember back to that trying to keep a sense of humor, which
Mhm.
sometimes I could do it and sometimes I couldn't. But I remember being in a doctor's office and seeing an elderly couple come in with their oxygen tanks or walkers hunched over, you know, could barely move. It was a neurologist's office. I knew they had to have a bleak
Mhm.
prognosis. And the man went up to the counter and he's flirting with the receptionist and they're laughing and stuff. And I remember thinking, no matter what I'm going to be facing, I don't know what this journey is going to look like.
Yeah.
I'm going to always try to have a sense of humor. And that kind of comes naturally to me. Do not think I always was able to do it, but that did help as much as I
Yeah.
could. Yeah.
Yeah. I know you may not know, but some of the listeners know that I was a mental health therapist for over 20 years. And a lot of times I would use that line. I would like, I'm not going to be worried about you until you lose your sense of humor for
Yes.
it's just like, okay. And you know what? Some people are like, they like hung on that. They're like,
Yeah.
okay. But if we can laugh, I mean, I think that's like mirrors hope. I mean, if we
Yes.
have that, there's a little bit different chemistry and how we look. If we can laugh at something, we can enjoy that. We can still
Right.
have that piece of us. We still have.
Yeah. 1,000%. And some of us, it just comes more naturally.
Mhm.
To
Yeah.
me, I think there's always like a laugh right under the surface, you know, all the
Right.
time.
Right.
But again, the challenges faced and
Mhm.
the journey I went through, that wasn't always
Yeah.
possible,
Yeah.
but it didn't take too long before it would eventually come out. Yeah.
Right, right, right. Yeah. A couple things before it was like, okay, so maybe if somebody doesn't have invisible illnesses or
Mhm.
anything, I mean, what have you learned that could be applicable to pretty much any of the listeners? I
Yes.
think
And
we've
this
touched a little bit on that already, but
Yes,
is there
because
anything
I'm
else?
such a huge believer in this
Yeah.
now. I always love helping patients. I mean, that the empathy I feel just never goes away. You know, I
Yeah.
talk to a patient, I'm right
Mhm.
back where I was. But much of my life now is focused on the rest of my life moving forward. That
Mhm.
illness robbed me of 10, 15 years of my life. I would
Mhm.
like the rest of my life to be maximized, for
Yes, yes.
purpose, enjoyment, true
Mhm.
happiness, not just, pleasure, but true happiness.
Yeah.
Um, so focusing on what does really make us happy,
Mhm.
having a sense
Mhm.
of purpose, that's a big
Mhm.
focus. And in order to do that, I have to maximize my health. So I
Mhm.
think
Yeah.
all of us do need to concentrate at some point on chronic inflammation. That's a thing.
Yeah.
That's going to get so much more attention.
Mhm.
Research is released, but being
Mhm.
able to stay on top of that, we can live a better life, a more active life,
Mhm.
and the progression moving forward could be so much more positive if we're able to do that.
Yeah. And I just feel like if people have that purpose or some goal or,
Mhm.
why, I mean, for you, I feel like your kids kind of pushed you through some stuff. I, I mean, it's hard enough for ourselves, but if we, I was like, oh man, I got to take care of my kids. Like
Yes.
my kids got this. I've got to do something. And that was, that pushed through for a while. But now it's like, okay, I want the rest of my life to be purposeful, still happy.
Right.
Like, no, none of us really, I don't think anyone really envisions, like, yeah, I really want to be, kind of walking around, like you said, on that elderly couple, barely walking on oxygen. I don't think any of us have the dream of that's what our life is like. So we have that choice, like health is wealth, right? In order to
Yeah.
do all of these fun things that we want to dream of, as we get older or when we retire or however anybody wants to view that,
Right.
we have to have our health.
Yes. And I remember growing up, my mom used to say, when you have your health, you have just about everything. But I was doing everything I knew of to stay healthy
Yeah,
and
yeah,
still got slammed like that.
yeah,
So
yeah,
things do come out of the blue sometimes,
yes,
and it's not our
yes,
fault.
right,
But as much as we can to take that into our own hands, we all do have or need to have a sense of purpose to truly be happy in our lives, right? And once you can figure out what your purpose is, and it can evolve over time,
right,
and
right.
it probably should. Um,
Yeah.
but some of the people I see who retire uh, are losing that. And
Mhm.
I think the purpose can morph into just pleasure, but that doesn't really provide happiness. Maybe
Yeah.
short term, but I think all of us need to feel needed,
Hmm.
need to
Hmm.
have a reason beyond just our own pleasure
Right, right.
to really be, be happy in life.
Yeah. And I
Yeah.
think that's the impact sometimes people want to have on others, the contribution piece that we all kind of want to feel like, we've done something like to
Mm.
better, whether it's our own family, the community, or whatever, but that happiness doesn't always equate to pleasure,
That's
or
right.
pleasure doesn't always equate to deep happiness. And so
Yes.
connections with others and how are you going to do that, and having that purpose and driven to do something more.
I've been thinking about this so much. And I do think the happiest times in my life were not necessarily the easiest times, right? They were the ones that had challenges I met and overcame them.
Mhm.
That's where the joy was. So I thought as we continue life, we want to make sure we still continue to challenge ourselves
Mhm. Mhm.
intellectually, physically, emotionally, spiritually, the whole
Yeah.
gamut, and work toward being better.
Right,
Yeah,
right, right.
absolutely.
And I think that's this whole, like, the whole idea for me is to try to give listeners like little bits and pieces of various different experts and books and thoughts and, topics to really hone in on what it is for them that can
Yeah.
challenge them to be just a little bit better.
Absolutely. I think like your podcast is so wonderful. And I'm always seeking out either podcasts or books, always looking to learn from others and improve my attitude and going through every phase of life to maximize what it offers. So I'm so grateful to you for magnifying the voices for others. I'm only one voice. There's only so much I can do. Um, but to reach as many people as possible to help with growth, right?
Yes,
Yeah.
yeah. Everybody has a story, and it's just so fun. And
You
I'm
are
so
right.
I'm so grateful that this platform is available to be able to share stories like yours, and you come on and just give everybody like some little bit of hope and a little bit of inspiration to just make their lives just a little bit better. So as like
Absolutely.
yes, where can people find out more about, what you're doing and if they feel like they, oh, I might have this invisible illness or POTS or anything like that, or they might know somebody. Like, where do they
Right.
go? And some of those supplements that you were talking about, like, where do they all go to find that?
You know what you're probably going to hear, Peggy, is you'll hear the word POTS now more often. When
And I'm like, I wasn't even going to attempt to like try to say what it actually was because I was looking it up and I was trying to like, no, I'm going to let the expert take that one.
Yeah, no, it's out there. I'm at potscare.com. The supplements, which I really hesitated to get into
Yeah.
supplements, but being at home making this for my kids and I for
Mhm.
years, I need to release this. And it was very validating getting these
Yeah.
patents.
Yeah.
They're at vagusnervesupport.com or TJ Nutrition. And I'm out on other things too, but I think that'll
Yeah.
usually get people to
Okay.
find me.
Yeah.
Yeah,
Awesome.
thank you.
Awesome. Well, thank you so much for joining me today. Oh, gosh, what a
Honored.
wonderful conversation and just inspiration for anybody in any stage. They don't have to be ill. Like, yeah, been there, done that,
Right.
not they healthy, and all of a sudden, wham, you get hit with something and then we recover. So there's some hope out there. Then, stay well. You have those choices to do that. But is there anything that you want to leave the listeners with that maybe we haven't touched on or just want to reiterate?
When we're talking about hope, that's so important. But also, something I faced walking into this was someone said, there's no way an optometrist could figure out this neurological disorder that has puzzled experts for decades. I thought, does it really matter what your degree
Mhm.
is in? I think we need to think bigger, right, on what
Right.
our capabilities are.
Yeah.
So
Yeah.
don't ever let anyone tell you you can't do something.
Right.
Those are fighting words.
Those are fighting words. I'm already putting my arm
Right?
on. I'm going to say, you want to make a bet? Because I
Yeah,
feel like somebody with fresh eyes,
right.
somebody that doesn't even have any knowledge of, the autonomic nervous system or anything like
Right.
that, could shed a great light, new eyes on something. I mean,
Exactly. Exactly. Yeah, if I had listened to those naysayers, I wouldn't have ever tried.
right,
If I had heard how difficult it was to get a patent on any sort of supplement blend, I wouldn't have tried. Instead, it was like, I think I can figure this out. Let's just do it. Yeah, yeah.
right. Just be mindful of the people that are around you and those naysayers because it's really their own limiting beliefs that keep them
Yes.
that way, and they're just projecting that onto you. But you don't have to take them. You just wrap them up in your armor, like shove them back at them. Just say, "Don't. I'm not listening to it. This is what I feel is right, and I'm just going to go do it."
That and the more naysayers there were, the more I knew I was really changing things,
Yes.
right?
Yes.
So it was actually ended up being a positive sign. Yeah, I
Yeah.
was shaking things up.
You were.
But
And
it needs to
I think
happen.
that is absolutely true
Yeah.
because I think we do have to realize the more people that are saying, "Oh no, 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 no," that
Right?
you're onto something.
Exactly.
I've heard that more than once. So
Yeah.
it's just like, take that as a sign, push forward.
That's right. That's right. Amen to that.
So awesome. Well, thank you so much for joining me today. It has
Mhm.
been a wonderful conversation, and I know the listeners take lots of things from this.
Excellent. I enjoyed it so much. Thank you.